Hello, this is Rashi Sahai, and you're watching Medicircle. Today, on our cancer awareness series, we have Dr. Bharat Chauhan with us. Dr. Bharat Chauhan is a renowned medical oncologist in Mumbai and is currently practicing in Bombay Hospital. For the past 16 years, he has worked as a medical oncologist. Welcome to Medicircle, Dr. Bharat Chauhan.
Thank you. Thank you for having me here.
So, in India, blood cancer has been among one of the most common cause of death, with an incidence of over 1 lakh people being diagnosed every year. So, doctor, can you please tell us what is blood cancer?
Blood cancer is a cancer of blood cells. Basically, we have three kind of elements in our blood. One is hemoglobin, one is WBC, and other is platelets. If any of these three gets deranged and have abnormal values, then these lead to formation of blood cancers, because the WBC, if they get deformed or they are having abnormal proliferation or formation, then that it can lead to blood cancers. That is what it is. And all these elements are having parents in the form of bone marrow. Bone marrow is a structure which is present in the center of the bone. So when these parents get deformed due to any cause, then there is a cancerous formation in these cells. And then these cells, when they develop cancerous formation, lead to blood cancer. It is as simple as that.
So, doctor, can you tell us that what are the types of blood cancer?
There are two types of blood cancers broadly. One is acute blood cancer, other is chronic blood cancer. As the name itself indicates, acute and chronic, it depends on the duration of blood cancers. And by this acute and chronic, it also gives us an indication regarding the severity of blood cancer. Like acute blood cancers, we have acute myeloid leukemia, we have acute lymphoid leukemia, whereas in chronic blood cancers, we have chronic lymphoid leukemia and chronic myeloid leukemia. So these are the two kinds of blood cancer. Acute are the serious ones, which are life-threatening and very dangerous and requires intensive treatment, whereas the chronic ones are milder versions, generally seen in old age and very treatable and are having good prognosis. This is how we divide them.
So, doctor, what are the stages of blood cancer?
Blood cancer, basically, if we see individual blood cancer by each type, then if we see acute myeloid leukemia or acute leukemias, there are no stages in them. As we see, they are serious in nature by definition. So there is no staging. Staging, why we are saying, is because in cancer we have stages from 1 to 4. As we all know, fourth stage blood cancer is incurable and it's a dreaded kind of a stage, and the death of a patient is imminent. That's what it is. But same we can't attribute to blood cancers, especially acute ones. Technically, acute blood cancers are serious. If you want me to stage them, I can only tell you that they are synonymous with stage 4 other kinds of cancers. Because they are serious, they are life threatening. If you don't treat them, death is imminent. So, as per staging, in acute, there is only one stage that they are very serious. If we come to chronic, we are talking of chronic cancers. So, chronic myeloid leukemia, again, they are not stages, they say phases. Phases. So, chronic, we have chronic phase, we have accelerated phase, and we have leukemic crisis. This is how we divide them. Other one is chronic lymphoid leukemia, in which actually truly there is staging. This is one kind of blood cancer in which there is a proper staging. We say stage 0, 1, 2, 3, and 4. Why there is staging? Because staging decides the treatment of the patient. This is how we can broadly talk about staging. But staging, generally, in a simple term, we can say staging has got no relevance in blood cancers. Broadly, for a layman person.
So, doctor, what are the signs and symptoms of blood cancer?
Signs and symptoms of blood cancers, we have to again go back to our first question that we have talked about elements of blood. The three crucial elements of blood: hemoglobin, WBC, and platelet. If we dig them deeper, we will be able to see the symptoms of blood cancers. First, if we talk of hemoglobin, we know that a lowering of hemoglobin will lead to weakness. We, we say in general terms daily that if there is a lowering of hemoglobin, there is anemia, then there will be weakness and easy fatigability. So same way, weakness, easy fatigability is a symptom for blood cancer. If we come to the second point, which is our WBC, if the WBC goes down or goes up, in both cases, there's chances of infections. Chances of infections like pneumonia, like other kind of infections can occur. These are also a symptom presentation of blood cancer. A blood cancer patient can present with a pneumonia also because of low immunity. Because WBC are our immune cells, which provides immunity to our body. Third, if we talk of platelets, what they does in our body is they are the clotting mechanism of our body. They stops the blood to flow. Whenever we have any injuries in our body, there is a bleeding. Bleeding that stopping mechanism is by platelet. If your platelet count is low, which is generally a case in blood cancer, you have increased bleeding tendency in the body. So bleeding, bleeding spots all over the body, or internal or external bleeding. Internal bleeding generally seen in lungs. Patient can come with breathlessness. Internal bleeding can be seen in brain. Patient can come with paraplegia or paralysis. Internal bleeding can come in abdomen. Patient can come with pain abdomen. So basically, symptoms can be devised from these three elements which are present in the blood. Also, in this way, a patient of blood cancer, if I summarize, can present with weakness, easy fatigability, increased chance of infections. He can present with fever, with breathlessness. Breathlessness can be due to pneumonia or due to internal bleeding in the lungs, and increased bleeding spots all over the body, and increased bleeding and increased bruisability. And apart from this, there are few symptoms like, there is a hypertrophy. These cancerous cells, they accumulate in the gums, so there is gum hypertrophy is generally seen in blood cancer patients. This is how the more or less we have symptoms.
So, doctor, can you tell us about the causes of blood cancer?
Causes of blood cancer, as such, there is no specific cause. I can tell you the first and foremost cause I can see is a bad luck. If you have a bad luck and God has decided that so and so person should get a cancer, then no one can stop you from getting cancer. So that is one part. One should keep this thing in mind, that when we look at causes of cancer, that especially blood cancers, one of the part is that God decides, and we suffers. That is one part. Second, what advancement we have seen in blood cancers is that they say that there is a genetic mutation in DNA. DNA, we all know, we have studied when we have seen in news, or in advertisement, that there is a DNA in the body. DNA is our genetic material which is present in the nucleus. If there is some damage, or there is some change in the gene structure of the DNA, that can lead to mutation, and that mutation can lead to uncontrolled cell proliferation, which is nothing but a cancer. So genetic changes, mutations, are the most important cause of blood cancers. I can say this is the most important cause of blood cancers.
So, doctor, can you tell us about that? What is the role of bone marrow in blood cancer?
Bone marrow.
Yes.
Bone marrow, again, if we go back to our first question, which we have discussed, that there is a bone marrow which is present in the center of the bone. That bone marrow is a house of parents of these blood elements, which we have just discussed. So the parents resides there, and they are responsible for production of our hemoglobin, WBC count, and platelet count. If there's a defect in the parent, then that defect can lead to cancerous formation, and that will be seen in your blood formation, and then it will be a kind of a blood cancer. So bone marrow is nothing but a house of these cells, blood cells, where this cancerous formation occurs.
So, how does a medical oncologist treat blood cancer?
Medical oncologists first diagnose blood cancer, then type of blood cancer, which we have discussed, acute, chronic, and acute also, which type. After diagnosing, typing, then medical oncologists risk stratify blood cancer. We have discussed regarding genetic changes. Those genes we discover, then we risk stratify. Then as per risk stratification, we give prognosis to the patient, and then we start treatment. Treatment is nothing but chemotherapy. Chemotherapy is a treatment of blood cancer, and we give chemotherapy as per type of blood cancers.
So, doctor, on Medicircle, our main focus have always been to provide the audience with large amount of information in less time. And so today we will be conducting a small question answer session in which you could either answer in yes or no or in one or two line sentences.
Yes.
So my first question is, doctor, that does smoking cause blood cancer?
No.
And do people with blood cancer have to undergo bone marrow transplantation?
Yes. Yes. There are selected few cases in which bone marrow transplant is a ultimate treatment, be it first line or whenever the disease relapses. In few cases, you have to go for the bone marrow transplantation. It's a crucial treatment modality in the management of blood cancers.
And can bone marrow failure increase the risk of developing aggressive blood cancer?
No, this statement is absolutely wrong.
Okay, doctor. Thank you so much for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure having you on the show.
Thanks for having me. Thanks a lot.
Thank you. Thank you.